Thank you. So hello, everyone. Welcome and thank you for joining us on the South Sudanese Women Intellectuals Forum. My name is Dr. Anne Lomole, and I am a pediatrician and an infectious disease consultant, and I will be your moderator for this session today. Today, we will be discussing dental health and the do's and don'ts of oral and dental health, and I have a number of panelists with us here today, and I'm glad they have been able to join us. It has been said that the mouth is a gateway to our overall health, and according to the WHO, oral diseases pose a major health burden for many countries and affect people throughout their lifetime. It causes pain, discomfort, disfigurement, and sometimes even death. So oral diseases affect about 3.5 billion people worldwide, so that's quite a huge number. And treatment for oral health conditions is quite expensive, and it's usually not part of universal health coverage. Therefore, most low and middle income countries, of which South Sudan is one of them, are unable to provide services to prevent and treat oral health conditions. Many of the factors that contribute to oral diseases are actually what we refer to as modifiable risk factors. And they include things like unhealthy diets that are high in sugar, the use of tobacco, and the harmful use of alcohol. Therefore, most oral health conditions are largely preventable and can be treated in their early stages. It is therefore important to be knowledgeable about the factors affecting dental health and the do's and don'ts of oral health in order to prevent these conditions. On today's panel, we will be joined for the very first time on the South Sudanese Women Intellectuals Forum by dental health professionals, and we will be discussing some common dental health issues, procedures in dental health in children, and factors affecting dental health, and some of the challenges that are associated with providing dental health services, and we will also mention some of the challenges in South Sudan. Our panelists will also discuss and offer advice and discuss recommendations and solutions for these challenges. I would like to thank our panelists for taking their time to participate in this discussion and the audience for joining us. We would also like to thank the UN Women for providing internet services for our panelists. And we would also like to thank Aisha and Robert, who are currently behind the screen on technical support. We are currently streaming live on Facebook and YouTube. Please feel free to share this discussion on all your social media sites, and do not hesitate to ask any questions on our wall. We will answer some of them, but for those we are unable to answer, we will request our panelists to come back later after the discussion is over and answer some of your questions. So I will go straight into introducing our panelists today. Thank you all for joining me on the South Sudanese Women Intellectuals Forum. I will start by introducing Dr. Lucy Theophilus, who is a consultant of restorative dentistry. She has a Master of Dentistry in Restorative Dentistry from the Muhimbili University of Health and Allied Sciences from Tanzania. And she also has a Bachelor of Dentistry from the University of Khartoum, which she got in 2006. She worked as a dentist and later on as a consultant restorative dentist in several hospitals, both public and private, in Sudan, in South Sudan, and in Tanzania. She is currently a consultant and head of department in the police hospital. Her technical areas of interest and competencies are in general dentistry, conservative and prosthetic dentistry, endodontics, periodontics, and geriatric dentistry, and oral health education and oral medicine. She's also a member of the South Sudan Doctors Union and the Tanzania Dental Association. At this moment, I would like to take the opportunity to have a moment of silence in memory of the late President of the United Republic of Tanzania, His Excellency Dr. John Pombe Magufuli. So let's just take a few moments in memory of the late President. Thank you so much. So I will speak a little in Kiswahili for the sake of our Tanzanian brothers and sisters. Tunaomboleza na ndugu na dada zetu kutoka Tanzania kwa kupoteza rais wa Jamhuri ya Muungano wa Tanzania, Dr. John Magufuli. Mola amweke pema peponi. Thank you so much for that moment of silence. I'll continue with the introductions. And next, I will introduce Dr. Joy Rubena, who is joining us from Khartoum. Dr. Joy attended dental college at the University of Khartoum in Sudan and completed her bachelor's degree in 2001. She trained at Khartoum Dental Hospital for 4 years as a resident and joined the Sudan Medical Specialization Board in 2004. She attained her Master of Dentistry in Oral and Maxillofacial Surgery in 2010. She then relocated to South Sudan and was the head of the dental department in Juba Teaching Hospital and a coordinator for oral health promotion and dental personnel concerns in South Sudan. She was also a coordinator of Brita Medical Insurance Company in 2018, and she's currently based in Khartoum, Sudan, and is a professor in the University of Science and Technology. Her main goal is the improvement of oral health and attitudes towards dental health professionals by the general public. Welcome, Dr. Joy and Dr. Lucy. Next, I would like to introduce Dr. Ajak Hussein. Dr. Ajak is a passionate dentist and dental aesthetics professional. She graduated from the University of Khartoum in 2013 and did her housemanship in Khartoum Hospital, Ribat Police Hospital in 2014. She also trained in dental orthodontics in Nairobi in 2018 and has trained in aesthetic dentistry, including smile design, Botox, fillers, veneers in Shams University in 2019. In 2019 to 2020, she did a dental implant fellowship in the Cairo Implant Academy, and she's passionate about presenting beauty in dentistry and has worked in private dental practice in Khartoum, in Wau, in Renk, and in Family Clinic and Queen's Clinic. So welcome, Dr. Ajak. Thank you all for joining us. I appreciate you being on this panel today. And I will go straight into our questions and start with Dr. Lucy. Dr. Lucy, the first question is for you. You'll be setting the stage for us. So if you could please define for us, what is oral health? How does one maintain good oral health? And what are some of the myths about dental or oral hygiene that you have come across? Thank you, Dr. Lucy. You're welcome.
Thank you, Dr. Ann, for the question, and thank you for the introduction. So I will just go straight to the question, and I'll start by defining oral. For us, when we hear about the word oral, we mean everything inside the mouth. So it's not only the teeth, but the teeth, the surrounding gum, the tongue, the palate, and also the lips. So when we talk about oral health, it's a condition whereby the mouth is free of disease. And when we say a good oral health, or how one can maintain a good oral health, we know that when we say your mouth is free of disease, we know there's some group of oral diseases which we are concerned of. Some examples of these diseases, we have dental caries, or we call it tooth decay. We have gum diseases. We have oral infections. We have orofacial pain and oral cancer. So these are some of the oral diseases. So to maintain a mouth free of these diseases, we have to do some home care measures and some long-term care. So the home care measures start with toothbrushing. We have to brush twice a day, in the morning and at night before sleep, using a fluoride containing toothpaste. So you have to brush for at least 2 minutes. So, and also one of the home care practice, we need to do flossing also. Flossing is cleaning in between our teeth using a thread-like material. So we call it dental floss. You can find it in a pharmacy. And also, we have to reduce sugar intake, because sugar intake, it plays a role in causing some of the, or most of the oral diseases. We reduce sugar intake. And going to the long term include visiting your dentist, because we know many of us, or if we say especially oral health in South Sudan, most of the people, they just visit a dentist when they are in need. But we want to encourage you from this platform that you have to visit your dentist for routine check, because some of the cases you don't recognize it yourself, but the dentist will recognize it for you. And some other systemic disease or chronic disease, they have oral manifestations. For example, those who have diabetes, they might present with dry mouth, reduced salivary flow. So dry mouth, it's a predisposing factor for many of the oral diseases. This is what I can say. Thank you.
See, are there any myths about oral hygiene or dental health that you have come across? What are they, and what do you think is the genesis of these myths?
You know, they are. Especially, you know, as I have said, we need to do brushing for at least 2 minutes. So some people, they think that brushing harder will clean their teeth. So this is one of the myths I have seen or some patient presented with. So they come with their teeth worn out because of the hard brushing. So you just need to brush gently using a soft toothbrush for at least 2 minutes, not more. And the other thing that some people think that flossing is not necessary, but I want to tell them that flossing is of course necessary, because we don't have any mean to clean in between our teeth unless you have spacing in your teeth. But otherwise, we need to do flossing for our teeth. And also one of the myths, people think that bleeding gums are normal, but actually bleeding gums are a sign of a disease, sign of infection or sign of inflammation. And also, tooth whitening. Some people think that when you go for tooth whitening, you will keep your teeth white, but it's the other way around. You will just damage your teeth and end up with sensitivity. So teeth whitening, it's done for a cause. It's done for a disease. So you don't do it for normal teeth, or you don't do it just for appearance, because it's more harmful than it's more harmful than keeping your teeth white. Thank you.
Well, thank you for that, Dr. Lucy. I think I had never come across that fact that teeth whitening actually ends up weakening your teeth and making it insensitive. I think it's important, the fact that you mentioned that we should actually visit the dentist regularly, because even some chronic illnesses have oral manifestations, and who knows, if that was missed in your checkup, then the dentist is able to identify that. I think for most of us, we are guilty of waiting for either our teeth to break, waiting to feel pain, or waiting to have cavities before we visit the dentist. But I think in view of what you've said, then we need to ensure that we do regular checkups to ensure that our teeth are not deteriorating despite the way we are taking care of them. So Dr. Lucy, I'll ask you your next question, because it's sort of like a follow-up. What are some of the common dental issues you've come across in your practice, and why do you think these particular dental issues are more common, and how can this be prevented or reduced?
Okay, thank you. The common dental issues I have passed through, of course, is dental caries, which is a common or more common in our practices, and also untreated dental caries. Patients may present with also dental abscess or dental infections. And apart from that, gum diseases. Some they present with early presentation of gum diseases, but some may present with the extensive gum disease, and the presentation will be tooth mobility and even sometimes tooth loss. Because when the gum disease is more extensive, it affects the underlying bone. And also the other common issue is dental trauma or dental alveolar trauma. Dental trauma is trauma of the teeth, and dentoalveolar is trauma of the teeth and the underlying bone holding the teeth. So the main reason behind this one, except for the trauma, is poor oral hygiene. Because as I have mentioned, brushing, flossing, and how to maintain a good oral hygiene, it matters in causing these diseases. But also dental phobia, because as I have said, many of our people, of our patients, they just present with pain or maybe swelling or something like that, something as an emergency. So they have that phobia, they have that fear to visit the dentist. So, and the other thing, for example, for the gum diseases, some people think that brushing alone can clean, but we don't know that brushing, even if you are brushing, some of the materials keep accumulating on your tooth surface, and with time it hardens, and it needs professional cleaning, which we call scaling and root planning. So this might be the reasons for these things. So how to be prevented or to reduce these issues? By giving oral health education to our people in terms, again, I will repeat, because, you know, when you talk about oral health, you will keep talking about brushing, because this is the main issue in causing many of oral diseases. So we have to talk about brushing, we have to talk about flossing and using of mouthwash, especially with those who have dry mouth. Because with dry mouth, there is, the bacteria is, the amount of the bacteria in the mouth is very high, so it will be more harmful to the oral tissues than before. So using mouthwash will reduce the bacteria. And also you need to regular visit to the dentist, so that the dentist will discover if you have, for example, tooth decay, it will be filled. If you have gum disease, you will need professional cleaning. And if there is any type of trauma, then you will go for fixation. Something we call it fixation is a type of, we fix actually the tooth part, especially with the dentoalveolar fracture, when we have broken tooth and they hold the underlying bone. So we need to fix that one, so that after some time it will be in its place. So I think this is how I can answer your question.
Thank you so much, Dr. Lucy, for that explanation and for giving us a brief overview of what the most common dental issues you come across in your practice are. I think many of us don't think a lot about gum disease, but it seems from what you're saying that it's more common than we think. And it's important to have it at the back of our mind that that is a possibility when we have issues with our gums, that maybe we actually have diseased gums and we need to be checked by the dentist. And thank you for emphasizing the fact that regular review is very important. Now, there's something that you've mentioned about people having dental phobia, and Dr. Ajak is going to give us an overview of what some of the most common dental procedures done are and what are some of the indications for those procedures. And then maybe you can also tell us, Dr. Ajak, how do you ensure adequate pain control? Because, you know, most of these patients are actually refusing to come to the dentist because of the idea that I'm going to have so much pain, and they use this really gadgets that look so scary. How do you ensure pain control during these procedures and after? And what precautions have been put for doing dental procedures, especially during this pandemic? And what's your advice to dental health professionals and to patients? Dr. Ajak.
Thank you, Dr. Ann. So let's start with how people in South Sudan commonly are afraid of going to the dental clinic because of the pain issue. In the past, like 20 years before South Sudan start having too many dentists, the dental professional used to be uh, like uh, like just dental nurses, and the training wasn't like well fully covered, so they used to make mistakes in applying the proper anesthetic and where to apply it and how to apply it. So the patients ends up with like a lot of pain. And those ones have been like a tale of stories. People been telling their like kids and now grandkids. So everybody have that misconception in their head. But nowadays, since we have people like Dr. Joy and Dr. Lucy and many other dental practitioners in South Sudan, things has completely changed. So let's talk about pain first. What is pain? So pain is not like the general feeling. Pain is like pricking and burning and stuff like those. But the normal feeling of touch, it will still be there. So whenever you take your patient to the clinic, you have to start with like telling them, here I am, I'm Dr. Whom and Whom, and I'll be practicing this procedure on you, and this is how we're gonna do it. Like reassure the patient first. Everything gonna go smoothly, everything have been trained for and have been prepared for. So his psychological issues will be like flattened. Now the next thing we go for like how start the procedure. We have like many types of anesthetics. Mainly in dental practices, we go with the local anesthetics, but there is other like major operations. Those requires general anesthetics. Let's talk about the local ones. The local ones, you have like an injection, which is made of lidocaine. Lidocaine is like a long-term anesthetics. So it works while you're doing the procedures, and it works really fast. After finishing that, you have to take the patient and give them something to sustain this feeling of not feeling any pain after the procedure. So you give them either bimvacaine, which is works like in a long term, few like 4 to 6 hours after the procedure. And then after that, you can give them Panadol, or you can give them ibuprofen, those things like make the pain really go away.
Thank you so much. I think that's a general overview that is very understandable and very simple to follow. What are some of these dental procedures that you do, and what precautions have been put in place during this pandemic in view of the COVID-19 pandemic going on? What precautions do you have as dentists to prevent the spread of the disease, or to protect your patients and yourselves?
So thank you, Dr. Annie. So since this COVID-19 started, it has been really hard for dentists to practice because they practice in the mouth, and the mouth is like area where you mainly contract the COVID. So what we do now is like wearing a face shield, wearing a whole covered body, and wearing like what you call it. You have to make like a glass shield where you put it on top of patient, and then you enter your hands through like circular openings. Then you can perform the procedure behind the glass shield, which is not available in South Sudan completely. And then we just practice the minimum things, wearing a mask, face shield sometimes, and normal gloves, and that's it, which is really very dangerous.
Thank you so much, Dr. Jack. I was hoping to have Dr. Joy on the screen. Hopefully she comes back. And I will just go back to Dr. Lucy before Dr. Joy comes back on. So Dr. Lucy, you talked a little bit about dental cavities and caries, and I wanted you to go a little bit more into that. What are the causes of dental caries? What are the misconceptions that people have about them? And what are some of the treatment options for the same? Oh, sorry, Dr. Lucy. Before Dr. Joy drops again, let me just ask her question, then we can get back to you. Dr. Joy, thank you for coming back to the show. It seems there's a bit of an issue with your internet there, so I'm going to ask you some of your questions a bit before I get to the other panelists, so that in case you drop, you told us a few things. So I'll start with your first question. What are the types and causes of staining of teeth, and how can it be prevented? What are the treatment options? And many people have been told that their teeth are stained because of fluorosis. So tell us a bit about that. What is fluorosis? What are the causes of fluorosis, and what are some of the preventative strategies and treatment options when it comes to fluorosis? So Dr. Joy is joining us from Khartoum. And you can go ahead, Dr. Joy, and answer your first question.
Hello. Okay, thank you. Thank you, Dr. Ann. Nice meeting you. My junior colleagues, Dr. Lucy and Dr. Aja. Well, with the technology, the network have gone. I have not had the first question. I think if at all you can repeat it, then I proceed.
Oh, sorry about Dr. Dr. Joy. So the first question is about staining of teeth. What are the causes of teeth staining, and how can it be prevented? Are there any treatment options? And tell us a bit about fluorosis also. What are the causes, and what are the preventative measures, and what are the treatment options?
Okay, thank you. I will talk generally about staining, and we'd like to enlighten to all the public, especially as we are talking to them, so that they benefit. This staining is simply discoloration. The teeth have changed. So the question is, what is the normal color of the teeth? So that you say your teeth have changed. Teeth, we have what is called the teeth color shade, of which we measure the color of the teeth, but it is not that white. What people think, it's yellowish, and that one, it appears white when it is in the black gums or gingiva, we call it, or it appears yellowish if it is in the pink gingiva. So it is whitish yellow. So when we talk of staining, means from this range of color, there's a change, or there is a discoloration, and that discoloration we always call it stain. It is very common, and we have two types of stain. There is a stain which is extrinsic stain, and there is an intrinsic stain. Yes, by extrinsic stain means the stain which is only on the layer of a tooth which is external. We have layers of a tooth. We have the enamel, the first layer of the tooth, then we have dentine, and then we go pulp. These are the structures of the tooth. So when we say extrinsic staining, then it is only on the surface of the tooth, not in the inner part of the tooth. So the causes for this extrinsic stains are many, and that include the food and the drinks we take. They can stain your tooth. Those who are smoking, taking tobacco, they can have that stains, the external ones. For the internal staining or the intrinsic one, it can vary from those who are having trauma in their teeth get black. For some medications which we take, also it changes the color of the tooth from this whitish yellow to sometimes brown or dark brown. And this also we call stain. The third staining is related to age. The more we grow, the more we become older, the more our teeth becomes yellow. And that's because the outer layer, which is called the enamel, is wearing out. And so that's the second layer is called the dentine. It starts to appear. and that appearance or that dentine have the yellowish color, and so that's we call it, that is change of color or discoloration in relation to age. Not only that, when we talk about medications, people taking medications, we have a lot of medications. People on antihypertensive drugs can have stains, as those who are taking chemotherapy, those who are taking antihistamine, and a lot of drugs that follow. It is not a direct but indirect effect to the tooth. So, talking about staining, it is a general talk whereby it is a concern to all public. When you see your teeth changing color, then you have to be conscious about that, because it is the teeth that represents you. You are smiling, the first impression. Then when you see there is any change, you like to find how you can prevent that or you can treat that ones. So for the intrinsic stainings, that's whereby you use tobacco, or due to tobacco, due to food or drinks that have made the stain. We usually limit the intake of that one, and we advise you seek a dentist for that, because they are professionals. For the intrinsic, we have a lot, but the most common is that one of fluorosis, which is mainly due to overexposure to fluoride. So these ones are mainly seen in the age in younger ages, from the life, then up to 8 years. This whereby candidates or patients develop this fluorosis, because they overexposed to fluoride, either in water or the toothbrush, the toothpaste which we give, which contain fluoride. They put it in such a way that fills your toothbrush, and then you start brushing. This accommodation of fluoride will result into fluorosis. Resulting into fluorosis, this will prevent, it have the advantages, it can prevent caries, but it will also bring that discoloration, which is the unwanted or that is stain, whereby it ranges from mild to severe. In mild, you see a chalky white appearance in your teeth, and then it can go to severe ones, changing to yellow and then to brown, which is severe, and that needs dental intervention, or those who are concerned with the tooth issues. Now, the treatment options. The treatment options for these ones, in mild cases, whereby you go, if it is the extrinsic one, you go and it is seen and the cause is removed, and then for the professionals, they do scaling and they clean and they do cleaning, and they use whitening materials to whiten your tooth. Although whitening of materials, as one of the colleagues have said, it weakens that enamel, and so it may reach to other complications, sensitivity. So my advice is, when you go to markets, you find people say whitening this and this one, this industrial things. It's better you visit your dentist and tell you what amount can whiten your teeth, so that you don't get to complications. Now, again, this is called bleaching. People bleach. There are customary things people bleach, but my advice is you go to your dentist. If it goes to this, for the mild ones, for the severe ones, there are other procedures which is done by the professionals, which they apply bonding hard resins. These are materials found in the dental departments whereby it's applied. If it comes to that severe one, fluorosis, then we go for crown, and then we have veneers. So this is about staining.
Thank you
But
so much.
better and all, yeah, better and all, prevention is better than cure. When you brush your teeth daily, and you use that daily flossing, and you visit your dentist yearly to tell you what's happening, and the things you consume, you limit their consumption, like the beverages and the fluoride we are taking. It have when you consume it more, it becomes fluorosis. But the little you consume, very small pea, like a pea, they measure it with a pea, just on the brush, and then it works. Thank you.
Thank you so much, Dr. Joy. I think what I find interesting is that the fluoride prevents cavities, and on the other hand, it can cause staining of the
Yeah.
teeth. So this is something that does a good thing and can do a bad thing on the other side. But I think you've clarified by talking about the amount is what matters, and the fact that mostly it's children who seem to have like more of a risk of getting fluorosis because it gets into the bone when their teeth are still developing, and this puts them at risk. Is it possible for you to like maybe advise in terms of parents trying to prevent that from happening to their children? What can they do before we go to your next question?
For children, I will talk generally on dental health and children and how parents can help. Fluorosis, I have said, it's one of the things whereby our kids get them. Cavities are also most common. Cavities, cavities, I mean decayed teeth. So when these things get in, then we have problem of eating, speaking. Even a child cannot play well if it comes to the cavities. Now, for for the kids, it have been there's a research which have been done that kids with cavities or any dental problem, they always bring low grades because they always miss school, and they miss a lot of things because of the pains and the infection. But the good news is it is preventable. For the fluorosis, we can use fluoride varnish. We can brush daily with fluoride, with fluoridated toothpaste, and we can use dental serum
Dr. Joy you seem to be hanging. Sorry. Could you please repeat that, Dr.
Oh,
Joy?
hello.
Yes, we can hear you now. Please repeat what you were saying. I think you hung for a bit there.
Yes. Sorry again. Now for parents, hello.
We can hear you, Dr. Joy. Go ahead.
For parents, how they can help their children is, for the babies, they can whip their gingiva at least twice, morning and night. They can just clean it. They can clean it. For those children who have gone to school, they need to brush their teeth twice a day. And these ones, their parents can provide them with a soft, small brush for kids. And you put the toothbrush yourself. You monitor. And then you go for visits, you pay dental visits to detect if there are any early caries. Again, for the older kids, I mean from 8 above, these ones now, they can brush, but you need to monitor them, because some kids with the flavor of the toothpaste, they begin to swallow. So monitoring your kid, putting that small amount of toothpaste fluoridated and then monitoring will all minimize this effect of cavities and fluorosis.
Thank you so
Thank
much, Dr. Joy. Thank you for that. I think it's important for parents to know what they need to do to protect the teeth of their children even before they get older, because I mean it starts in childhood, really, ensuring that you have good oral and dental health. Now, you had told us a bit about some of the medications that might affect dental health. We'll just go to your next question, and there's even a question from the audience that's related to that. So what are some of the chronic illnesses that affect dental health? How do they affect dental health, and how can this be prevented? And someone from the audience has asked that if you could just enlighten us on some of the medicines that lead to teeth staining. She was told that her teeth were discolored because of tetracycline tablets. So maybe talk a little bit about medication and their effect on the teeth, and specifically tetracycline, if you have any experience with that. So how do chronic illnesses affect dental health, and how can this be prevented?
Well, chronic diseases, this always we sometimes are the first to manifest. They are manifested in the oral cavity. A lot are manifested in oral cavity. We have like diabetes. Most of diabetes, if not almost, are discovered by dentists, because patients with diabetes, they presented to oral departments seeking for fixing their teeth, because their teeth get loose. When the teeth get loose, they don't go for medical checkup, they come for dentists. And on doing examination and some investigations, we always get that people who have loose teeth, apart from excluding any dental cause, they go for the diabetic patients. So diabetes affect most of the oral cavity, especially the gingiva or the gums. Let me say the gums, because gingiva is a term, a medical term. Let me say the gums. It affects. Not only does those who are taking antihypertensive drugs, nifedipine, they always, the long term, they presented with enlarged gingiva, a generalized enlarged gingiva. So when they come to dental department, they are coming for the enlarged gums. But when you go deep and then you go for the history, and you do all your dental examination and investigations, after clearing, then you find that they have been on long-term drugs for hypertension. What we really do advise is always we are in consultations with our colleagues who are in the other departments in such cases, either to reduce the dose or alter the dose for these clients or patients.
Thank you so much. I think for this is the first time I'm hearing about a collaboration between the medical professionals and the dentists, and in view of side effects for medication, in view of detecting actually chronic systemic health diseases in patients through just looking at their oral cavity, which is their mouth and their teeth and all that goes with it. I think it's interesting that you're able to identify that by just looking inside the mouth. And that is very, very amazing work that dentists do. So I'll move over to thank you for that, Dr. Joy. I'll move over to Dr. Lucy. Dr. Lucy, we can go to the question I was asking you before Dr. Joy came back in. And one of the things that you've mentioned about some of the common dental issues that we've come across was dental caries. And we would like to know, because this is something that many of us have suffered from, what causes dental caries, and what are some of the misconceptions about them, and what are some of the treatment options that you have for managing people who have dental caries? Dr. Lucy.
Okay, thank you, Dr. Anne, for the question. So dental caries, as most of us know, or we call it tooth decay, it's the most common oral disease or the most common dental issues presented with our patients. And when we talk about the cause, it has, it's actually, we call it multifactorial. So many factors come together to cause dental caries. So when we talk about this factor, we have the normal bacteria in the oral cavity or in the mouth. As most of us know, we have a normal bacteria present in the mouth. And plus the sugar intake or the food we are taking, and then the tooth material itself, and then the time factor. So as a normal process, the bacteria in the mouth, it work on the sugar or the carbohydrates, the fermented carbohydrates, so it produces acid. But because we have saliva in our mouth, so the saliva will wash most of this acid away. But when we find somebody with a high sugar intake, so the production of this acid will be more, so it will be more destructive on the tooth. So the acid produced from this process, it's the one damaging the tooth, and it's the one we call it dental caries. And the tooth will end up with cavitation. So this is the cause of dental caries. So there are many misconceptions actually about dental caries or tooth decay. So most of our people, they think that dental caries is caused by worms because we have some who have appeared to our clinics telling us stories about how they were treated locally or treated traditionally, that they open their mouths and some worms come. So they think that caries is caused by worm, but caries is caused by bacteria and some other factors. Also, the other misconception that some of us, they think that you will detect caries alone on your tooth. But I want to reassure our audience that you cannot detect caries when it's in its early stage because it appears as a whitish discoloration, not black. The early caries appears as a chalky white appearance. So that one, you yourself cannot identify. So unless a dentist can identify for you. And the last misconception that dental caries is an inherited disease. We can agree, but some researches are still going on to confirm that dental caries is inherited, because some of our patients will come and tell you that my dad has caries all his teeth, my mom and some family members. So there is nothing up to now confirmed that dental caries is inherited. So the treatment options for dental caries, when it's identified early, so we do a simple filling. Sometimes, you know, the tooth material itself, it differs from person to person. Some people, they have, for example, when we take the molars, they are deep. Some people, they have deep fissures, or the upper surface of the tooth is more deep, so it's more prone to caries. So when you come in the early stage, we can put for you something called fissure sealant. We seal these areas so that it protects you from dental caries. But when it's going deeper, of course, we do simple filling. Then when it goes deeper, we do also filling, but now we consider the destruction happens on the crown. So when there is more destruction, we have to do the filling, but we have to cover now the tooth with the crown. A crown, it's like a cup we cover within the tooth surface. As the caries go deeper, affecting more tissues, it can reach to the tooth pulp, because as my senior colleague mentioned, that the teeth composed of outer surface enamel, we have dentine, we have the pulp. So the pulp, it's the inner surface, and it's the one having the nerve endings. So when it reaches in that place, now fillings alone will not be enough, because the patient will present with severe pain. So we go for something called root canal treatment, where we clean all the caries, and we clean it even from inside the pulp, and we remove these nerve endings, and we fill the tooth, so the tooth will remain there to function. And the last option of our treatment is tooth extraction, of course, which is the most common people seek these days. They just come and tell you that remove my teeth, although the teeth can have some other treatment option, like I have mentioned. But also with tooth extraction, we still give you a hope that these teeth can be replaced. When you remove your tooth, it still can be replaced. Thank you.
Thank you so much, Dr. Lucy. I like the fact that you said that for most of the dental caries, we cannot identify them ourselves. We're just looking at our teeth in the mirror. And I think that's a misconception that many of us have. And we wait for it to turn black before we say, okay, I have a cavity, and then we go to the dentist. So as before, you are actually emphasizing the statement you first made, that people should go regularly to the dentist, because there's some of these early dental caries that can be identified by the dentist that we cannot identify. And if we get there early, then they don't have to go into very invasive sort of procedures to sort it out. So you talked a bit about root canals, and Dr. Ajak, what could you just expound more on root canals? Dr. Lucy had started, and tell us what the indications are for root canal. What are some of the myths that people have about root canals, and what are some of the benefits, and how do you care for a root canal after the procedure? I know it's almost one of the last things that dentists do, but many people don't really understand what it's about. Could you please just enlighten us on that, Dr. Ajak?
Thank you, Dr. Ani. Growing up, my grandmother used to always ask me what I want to be when I grow up. So I used to tell her I wanted to be a medical doctor. But as being in a community of South Sudan, I've just seen like too many things in their oral, like teeth and all overall, having many problems, and then they need like a future dentist. How I started taking in my head that I wanted to be a dentist, this is how it started all. So let's talk about the root canal, as you said. So the root canal in general, you can say it's like sequences of treatment. It's not one single one. It's a sequences. It start like one visit, a second one, and the third one. It can go up to 4 or 5 visits according to the status of your tooth. Let's see the indications. How can I decide that this tooth needs a root canal treatment? It's according to the infection migration. So the infection starts on the enamel, as my senior says. When it starts on the enamel, it's the upper surface of the tooth. But if it goes deeper, then we say, oh, this tooth may need a filling. Then if it goes deeper into the living part of the tooth, which is the pulp, that's when we will decide like this tooth probably need a root canal treatment. I'm taking a root canal treatment as a basic treatment. It's very important to maintain a mouth full of dentition, functioning dentition for every single individual. So in South Sudan, generally, when people come to the clinic, they ask you like to do an extraction or to perform like a filling. But whenever you tell them you need a tooth root canal treatment, they will start like saying, no, this is like, this is not a thing I can do in my mouth. It's not important. I will not benefit from it, which is very wrong. because the root canal treatment plays like the first line of maintaining a good dentition in the modern dentistry. This is something we need to understand well in South Sudan. Well, when the infection immigrates into the pulp or the inner part of the tooth, that's when the patient or the person start feeling like excruciating pain, and they will come running to the clinic like, I need help, extract my tooth. It's not that way. I need help, please solve my problem, or check out what's making me feeling all of this pain. And then we go for the root canal treatment. Let's talk about some of the small myths they highlighted in the community of South Sudan. The first thing I heard like about over 30 times is that root canal actually causes cancer. All the jaw cancer personnel that came to the clinic while I'm working in South Sudan, they tell me it's all started with the root canal treatment with this doctor, which is really very wrong, and root canal doesn't cause any cancer or anything. The second thing that people tell me, you know, I had a good vision and everything, but one time I just listened to that doctor and I accepted him to like perform a root canal on my teeth. It doesn't cause no vision impairment. It's actually not related. The third thing, like a bit educated people, or like the one that been around like oral health or trying to take care of their teeth like more often, they came up with the root canal treatment can cause like bone resorption, which is the opposite actually. To perform a root canal, you're saving the jaw bone from resorption and from like wearing off by eliminating the infection. So root canal, it only does you good. It doesn't do no bad. Let's talk about the benefit of root canal in general. So if I perform a root canal on one tooth, I'm actually saving the tooth from deep infection, because the infection goes into the pulp. Then from the pulp, it can go into the bone and causes bone resorption, the infection. And it causes like many other health problem like spaces infection, mandibular spaces infection, and general faces infection, facial spaces infection, which can be like really challenging. For you can't treat it in an outpatient. You have to like bring the patient inside the hospital for some days, and it requires like high doses of antibiotic and painkillers, and it's really like what you call it. It's an unpleasant experience for a patient, which can be eliminated from the beginning by just performing a normal root canal and eliminating the infection. Something else too, if you perform a root canal treatment on a tooth, you actually preserving that tooth by keeping it inside the mouth, functioning well, you eating with it. It's staying in the space, saving the space, and preventing the upper tooth from over-erupting, and saving your bite. Your bite will still be the same. You won't have like tilting teeth or anything because of the space that have been created by losing a tooth or anything. So root canal, it's a very, very important procedure, and we have to start considering it in South Sudan. Another thing too, it's not only the hard tissue like the bone or the teeth. By making a root canal treatment on a tooth, you're actually saving the soft tissue around it as well. Because losing the tooth or having a bone infection will destroy the soft tissue, which is really hard to bring back unless we perform other procedures like grafting and stuff, places you don't need to go to. if you do the root canal treatment in the beginning.
Thank you so much, Dr. Ajak, for that in-depth explanation about root canals. I think there's a lot of fear surrounding doing root canals, and you have at least touched on a few things and dispelled some of the myths that people have. So next, I will go to Dr. Joy. Dr. Joy, I'll ask you one general question, and then we can go into something I think you're very familiar with as a maxillofacial surgeon. So if you could just give us a short overview in terms of nutrition, what kinds of foods or nutritional information would you give to ensure good and strong, healthy teeth, and what should one stay away from? I think Dr. Lucy said a little bit about those, but after that, then you can also talk to us about the cancers that affect the oral cavity and what the dentist's role is in managing them, and whether cancer treatment affects dental health, and how does the dentist prevent that from happening. So a bit about the nutrition, what to stay away from, what to take to ensure good, strong, and healthy teeth, and about cancers that affect the oral cavity and side effects of cancer treatment that affect dental health. Dr. Joy. Dr. Joy? Dr. Joy, can you hear me? If you can please unmute yourself. Okay. Dr. Joy, the next question is for you. To tell us a bit about, in terms of nutrition, what foods should we use to make our teeth strong and healthy, and what should we stay away from? And tell us a bit about oral cancers that affect the oral cavity and the side effects of cancer treatment, whether they affect the oral cavity or not. Okay, I think we've lost Dr. Joy there. Okay, that's fine. Dr. Lucy, we'll go to you before Dr. Joy comes back on. So, Dr. Lucy, there's a question from the audience that is related to one of the questions we wanted to ask. What are the causes of bad breath, and how does one manage bad breath? And so someone is asking, what is the difference between bad breath and halitosis? And is halitosis and bad breath related to lifestyle or genetic disorder? Sorry, Dr. Joy, you're back. Dr. Joy, can you hear me?
Yes, I'm back, please.
Ah, great. So I had asked you,
not had
I don't know whether you got what I asked.
What was the question?
So I had asked something that Dr. Lucy had talked a bit about some of the foods that predispose us to dental issues. So what I was asking is that, just for general information for the public, what are some of the foods that you would advise to avoid, and what are some of the foods that you would advise people to take in view of making teeth healthy and strong? And then I wanted you to talk a bit about oral cancers. I think we're having a bit of an issue with the internet for Dr. Joy. So what I will do is I will wait for her to come on, but we will go ahead to Dr. Lucy. Dr. Lucy, a question about bad breath. Is there a difference between halitosis and bad breath? And is it related to lifestyle? Yes, Dr. Joy.
Yes, things are going bad with me here.
I understand. Go ahead.
Network is okay when I just get in. Yeah, for what we need to good oral health. By that one, I need. I mean, we need a good gum, a healthy gum, and we need strong teeth. So some of the rich the food that are rich in calcium, milk, yogurt, cheese, these ones, they are calcium rich. They can make our teeth stronger. Again, we have phosphorus rich food like eggs, fish, lean meat, and nuts. These ones, they have phosphorus, and we need these materials or these minerals, the calcium plus the phosphorus, to make our tooth stronger. Now, things which wasn't, which or the food which are not good, but we cannot do without it. We have this sugary sweets and candies. At least you can eat, but after eating, you wash, you rinse your mouth, or you eat those ones. The factories, or these ones, the companies, or this which make these candies and all this sugary sweet food. You will find in their paper, on their outlets, they are writing, you eat and easily dissolve. This one, they don't stick into your teeth. Anything is sticking to your teeth for more than hours. These are not okay, because bacteria will come, and when bacteria reacts with that sugar, it produces acid, and acid produce the cavities or the decayed tooth. So sugary sweets, you eat them, and you see for those ones which are easily dissolved. And their rinsing is very important. Example, for kids, you cannot tell them to stop eating sweets, but at least we tell them, you eat, when you eat, can you just rinse your mouth, or you can wash your mouth, then things will balance. But you cannot stop them while you don't have another alternative. You give them, they eat, and then they wash after eating. Soft drinks, we are fond of soft drinks, and this one contain acids like wines, citric fruits. The beverages we have, this one, all they have acid. We need to take, but with we need to minimize. I can say we minimize their intaking, because their acidity affects our teeth, and that causes caries. So for the food, as I say, for good food, see anything which
Thank you, Dr. Joy. The next question I wanted to ask you was, what cancers affect the oral cavity
we
and teeth?
yes,
What is
we
the
have
dentist's
to.
role in managing them? And does cancer treatment affect dental health, and how? And what is the dentist's role in managing these side effects?
Minimize sugary disease. Thank you.
Sorry, Dr. Joy, I think we must have crossed each other over at some point there. So I wanted to ask you also about oral cancers. What is the dentist's role? Sorry, okay. We're having a lot of issues with Khartoum there, so we'll just cross over to Dr. Lucy now. Dr. Lucy, tell us a bit about halitosis. Is it related to lifestyle? Is it genetic? What is the difference between that and bad breath? Dr. Lucy. Dr. Lucy, you're on mute. If you can unmute yourself.
Okay, sorry. Thank you for the question. I think halitosis and bad breath, they are the same, but it's different from morning breath, because morning breath, it's when you wake up immediately in the morning, you will have some bad smell from your mouth, but that one, it goes off when you brush. But bad breath or halitosis, we define it as a chronic bad odor that mouthwash or even good brushing cannot take them away. So, and they have causes, of course, and causes of bad breath. They can be localized in the mouth. Some of them, they are from the GI, gastrointestinal, and some of them, they are psychological. So when we look at the causes, we have the first one, we have cavities. When you have cavities in the tooth, food remnants will accumulate, and it's difficult to clean them. So you will end up having bad breath or halitosis. The other cause is gum diseases. As we have mentioned, that gum diseases, it's infection of the gum. So with infection of the gum will be swollen and it will create something like a pocket. So that pocket, food remnants will remain there. So it's difficult to clean them also, and then it will produce this bad breath or halitosis. But also we have oral infections, throat infections, and dry mouth also. It causes halitosis or bad breath. But also we have smoking. Smoking is the most common local cause for halitosis or bad breath. We have some of the other, we can call it systemic causes. Systemic causes are those who have gastric reflux. It appears as a bad breath in the mouth. Those diabetic patients, those with liver diseases, those with renal diseases, all they can come with the manifestation of bad breath. But the third type, which we call it psychological, it usually occurs in women at the after menopause. So most of them, they come with bad odor of halitosis. So how do we manage it? The management is that simply by brushing. This is according to the American Dental Association. You brush twice a day, as we have already mentioned, twice a day using fluoridated toothpaste for 2 minutes. You use also dental flossing. You clean in between your teeth. But for those who have dry mouth, and especially those diabetic patients, they have to drink plenty of water. They have to chew sugarless gums so that it will increase the production of saliva. Also, we need to use mouthwash to reduce or to kill the bacteria inside the mouth. So when you use these measures, we call it home care. When you use them and still you are complaining of bad breath, so now you have to check your dentist to discover more of the problems inside the mouth. So if there is cavities, will be filled. If you have gum disease, they will do for you professional cleaning. And if you have any oral infection, they will take care of. But when the dentist finish doing all these things and the bad breath or halitosis continue, now they will refer you to see a physician so that they will do further management. They will check more about your health. Maybe you have any one of the chronic disease that cause bad breath or halitosis. Thank you.
Thank you so much, Dr. Lucy. Dr. Joy, will go back to you so that your internet doesn't get you off the screen. So the next question I wanted to ask you, I don't know if you can hear me clearly. There's a bit of noise in my background. When it comes to pregnant women, is dental and oral health different, and why? And what would you advise pregnant women when it comes to dental health? And what precautions are taken when they need dental procedures, and why are those precautions taken? So dental health in pregnant women, is it different? Are there some precautions taken when they need dental health procedures?
Okay, thank you, Dr. Anne, once again. Pregnancy, when we come to pregnancy, it is generally the same, whereby all the systems in the body have some defects. So when we talk about pregnancy, it's very important. For pregnant women, their immunity is always low. Lowering the immunity means there are a lot of changes in the body. There are hormonal changes. These hormonal changes does not affect affect all the parts of the body, and oral cavity is not an exceptional. Changes in the hormones brings about changes in the behavior of a pregnant lady, for example, whereby sometimes they develop this morning sickness. They like consuming other food more than the others, and they prefer things during pregnancy. Now, there is a common talk whereby pregnant women always say, when I'm pregnant, I have got out this tooth. This child, I've the other tooth out. Now, the relationship is when someone's pregnant with the hormonal changes, there are three things which happens in the oral cavity. There is the gingiva becomes inflamed, and we call it gingivitis, because of the habits of changes with the pregnancy.
Sorry, we dropped Dr. Joy there. Hopefully she comes back on. As we wait for her to come on, we can go to you, Dr. Ajak. You had talked a little bit about, from your biography, you have done a bit of training in implants. And the question for you is, what are some of the treatment options for teeth that cannot be filled or have to be removed? And tell us a little bit more about teeth implants. In which situations are they done? And what procedure is used? And are these services available in South Sudan as per your practice? Are they available? Dr. Ajak. Dr. Ajak, if you can unmute yourself.
Sorry. Thank you, Dr. Ann. So when will we decide that this patient needs an implant? When they lose their teeth, either partially or completely. Pardon me. Either partially or completely. Either ways, we can replace with an implant, a single one or multiple implants. And then they carry bridges or crowns or partial dentures as well. Let's start with what is implant. An implant is like a surgical component, and we take that surgical component and we interfaces with the bone. Like we put it inside the jawbone, and it has to integrate with the bone. It have to be like one. It have to be one with the bone, and that happens with a little bit of extra time, like 4 months or 3 months after starting the procedure. We take the component, we put it in the jaw, sometimes the skull, sometimes we put it as a support for a prosthesis or a crown and bridge or a facial prosthesis as well. As I said earlier, it works like an anchor for the orthodontic department. They put like mini or small implant, they integrate inside the bone, and then they use them to pull some of the teeth, into the direction that it requires. How do we place it? It's a total surgical, but it's like a itty bitty small opening. We just do it like a few centimeter or process. We start with the drilling, special drilling machines. We drill, and then we introduce the implant into the bone that we needed to integrate in it. Where the implant later after integration will work as a root mainly.
So, Dr. Ajak, it's okay. Thank you so much. We'll move to Dr. Joy and come back to you. I can see the baby wants a bit of attention there. So we'll come back to you Let's move to Dr. Joy. Dr. Joy, the next question, maybe you can continue to answer the question on pregnancy. If you can speak in Arabic, that would be really, really nice. And then after that, I can go to the question on oral cancers. So tell us about how dental health is different in pregnancy. And if you can speak in Arabic, although I don't know the classical one, you can explain, and then we can go to the question on the oral cancers. Dr. Joy. Dr. Joy, you're on mute. Unmute yourself. Dr. Joy, we can't hear you. Please unmute yourself. Dr. Joy. Thank you. Thank
Yes,
you.
hello. Yes, I'm.
Yes, please start.
Yeah.
We could not hear
Yes,
you. Go ahead, Dr. Joy. You've muted yourself again. If you can please unmute yourself.
hello.
Yeah. And you can speak in Arabic
Yes.
for the sake of those who are struggling to follow the conversation in English. Tell us about dental health in pregnancy. You were giving us an explanation before you dropped off.
Okay. Yes. Pregnancy. I've 10 years. Pregnancy. When we talk about pregnancy, it is different, and that's because when someone is pregnant, in the oral cavity, they develop gingivitis, الهو التهاب اللثة. And not only gingivitis, they have increased risk of developing caries because of poor oral hygiene. And not only that, they have what is called pregnancy tumor. This pregnancy tumor, there are small swellings which is found in between the tooth. This all comes with pregnancy. I say it's due to that hormonal changes and the behavior of a pregnant woman uh, with the hormonal changes. So for pregnant women, we need to take some precautions when a pregnant woman comes to your clinic, especially in the first trimester. First trimester, I mean the first 3 months, we need to take care. We are afraid of causing stress, and by causing stress to a pregnant woman during dental procedure, it may lead to some stillbirth or abortions of the discouragement. So we need really to be concerned about that. Not only that, we need to see when we do dental procedure, we need to see medications we need to give to them. Because as you know, when people come to dental clinics, they are always afraid. So we need to minimize it. We need not to increase their tensions. So for pregnant women, we always do dental treatment with care. It is safe. First, I would like to say it is safe. And we can do it from the first trimester to the last trimester, but preferable is the second trimester. That is from 4th month to 7 months, beginning of 7 months. You can do normal dental procedure for pregnant women. Concerning always when they come, they are concerned about x-rays. And sometimes for us, we need to do that x-rays for them. With this modern dental x-rays, the radiations are very low and it does not affect. So you minimize your dose to single dose, and you need to put the lid apron. You make a cover. It's a cover. You cover, and then you take your x-rays. But we prefer uh, doing x-rays in emergency if at all it needed. Although it's a small dose, but it is up to now not guaranteed that it does not affect. But in case of emergency, you can put that apron and then you proceed. Again, for local anesthesias, because you need to do your dentistry or your dental work, you need to do it. So safe, then you need to put, it should be safe and the patient should be comfortable, especially the pregnant ladies. So when using local anesthesias, we can use any local anesthesia, lidocaine, except one, which is called flipiprazine. We don't use it. We avoid it because it causes vessel constrictions. But otherwise, even some pregnant ladies can go for sedation, and the preferable sedation is nitrous oxide, or they call it the laughing gas. Now, our advice for pregnant women, we think before even you think of the pregnancy, please contact your dentist, because the earlier you contact, or the earlier when you are visiting your dentist, then he discovers, or they discover what is to be repaired in your oral cavity before it comes to pregnancy, which always have low immunity. There's a high tendency of infections before getting into that one. Now, what we recommend for pregnant is to brush. They brush thoroughly. They use dental floss daily. They eat a balanced diet, and they have to maintain a good oral hygiene by visiting their doctors and by following frequency. Instead of doing it for the normal people twice a year, they can increase the frequency to avoid any complications. Thank you.
Thank you, Dr. Joy, for that. I think you saying that it's actually safe to go to the dentist during pregnancy is a good thing,
Yes.
because I can imagine if I have a dental issue and I'm in severe pain and you're the ones who can sort me out and I'm pregnant, then it would be scary to think that you cannot help me because of the pregnancy. And you've also talked about the importance of actually wearing the lead cloth to prevent that exposure to the x-rays, even though you're saying the dose is low, but since we cannot say for sure that it won't cause any harm, then they have to actually wear that protection. Thank you for that. So I'll go to your next question. What cancers affect the oral cavity, and what is the dentist's role in managing them? Does cancer treatment affect dental health, and how? And what is the dentist's role in, or dental surgeon's role in managing these side effects? So a little bit about cancers and the oral cavity.
Cancers. The most common cancer which affects the oral cavity is the squamous cell carcinoma and mucoepidermal carcinoma, and all cancers which can appear in the whole body, they can as well appear in the oral cavity. So when they appear in the oral cavity, there are two treatment. Either we go for surgery, or some people go for chemo and radiotherapy. These are treatment for cancers. So preferably, before, it is a protocol worldwide, before going for any treatment of cancer, being chemo, radiotherapy, then you need to follow to go to a dentist and make a dental clearance. It is known as a dental clearance, whereby you go, the dentist see all your teeth, the decay ones are filled, the bad ones are taken away, those which can be restored are restored before time. Because when you get to that treatment, which is chemotherapy, radiotherapy, then this treatment itself have an effect on the salivary glands. They damage it sometimes. Damaging it means reducing saliva. Reducing saliva, which is an important element in the mouth, it washes the mouth, and this one. Reducing saliva means more bacteria in the oral cavity not wash due to no a good amount of salivary flow due to chemotherapy. So we do clearance before people getting the treatment. After, for example, if you do clearance and then again you go for your chemotherapy, we are always in consultation with the oncologist or people who are treating the cancer. we are always with them on consultation because it is at a certain stage whereby you can start dental treatment. Otherwise, when you start dental treatment, example like extraction, then the patients go for more complications. Like there's something called osteoradionecrosis, whereby the bone have low blood supply. When you extract a tooth, the tooth does not heal, and then it gets necrosis. So for cancer patients, the same cancer found in all body can find oral cavity, and it is the same treatment. But what is more concerned, we do dental clearance before cancer. It's a worldwide protocol. But after that, you can also get
Sorry, Dr. Joy is joining us from Khartoum, and the internet is not very stable, so we'll keep going back and forth to her. I like where she was going with the explanation about dental clearance before you start treatment for cancers, and the fact that she said that any cancer that affects the body can go to the oral cavity, and that is something that shows that even as dentists or dental surgeons look into the oral cavity, they're not just looking at your teeth, they're also looking for signs of any other diseases, including cancers. So Dr. Ajak will come back to you. I hope the baby has been sorted. I'm a pediatrician, so I'm worried about that, but that's good. I hope they've been sorted. And you were talking about teeth implants, and you were giving us an explanation of what is done, and you had already told us what the indication is, and we had also wanted to know whether the services are available in South Sudan. And one of the questions that the audience is also asking is about crowns and bridges, and they're asking whether one of the side effects is headaches, and whether the bridges affect the gums and the way you smile, and whether that can be corrected. So just finish telling us about the teeth implants, and then talk a little bit about crowns and bridges, and if there are any side effects that anybody should be worried about. Dr. Jack.
Thank you, Dr. Anne. So let's continue talking about the implants. The next step I was about to talk about, it's the implants component. Like the first thing, we have the implant body. We insert it into the bone, it integrates. Then we have a healing abutment. We put it on top, and then we use another abutment on top of it to hold the prosthetic part, which is the bridge or the crown, or according to the case, we'll decide what to put on. That's how the implant should look, and it should take up to 9 to 10 months to finish one implant, from the integration until the crown, or putting the last part of it, which is the prosthesis. To place an implant, it has other requirements inside the oral cavity, which is a hard tissue requirement, a level of the bone, and the density of the bone. The soft tissue and the thick type of the soft tissue, it's the required one.
Dr. Jack, if you can hear me, you're off camera. Okay, go ahead.
Yeah. The soft tissue, we go for the thick type, because the thin type mostly need need a grafting, which takes times as well. It can be done, but it's not like the ideal requirement. So the bone need to be like high in level, needs to be dense a bit, or a medium density, or the soft tissue needs to be thick as well. That's how we decide, oh, this case can be selected for the implant. According to that, we can select the implant type, the length, and the width of it. And between every implant and the other, if there are thick implants, we need to have like 3 millimeters between one implant and the other one. If there are thin ones, we need to have like 2 millimeters. It will be okay in that range. Let's come for the question of, is this service available in South Sudan? It's actually about to be available in South Sudan, because now we have like 3 dentists are well trained and they know what to do about and how to choose the treatment plan for an implant case and how to come around the challenges and the complications of the implants. We're only waiting for like the setup of the clinic and bringing the requirements of the implants themselves, and the proper unit to perform an implant procedure and to place them in a separate implant clinic in Juba, South Sudan, which can be like a refuge for all the South Sudanese to come there and have their implants done in their homeland with a proper price, instead of traveling outside and all of this. And you ask another question about the procedures and if they cause problems with the bite or the smile. The best person to answer that question would be Dr. Lucy, because she's the specialist in that. I can't come over it. She's the best one to answer it, so I reverted to her. Thank you.
So Dr. Lucy, and maybe Dr. Joy can help up to this. What the audience was asking is whether crowns and bridges cause headaches and whether they affect the gums and the way you smile. Dr. Lucy.
Thank you. Thank you, Dr. Jack, for referring the question. Crowns, when they are done well, it can cause headache or it can't affect the gum. But when the finishing of the crown, it's supposed to rest on the tooth itself. But when it comes over the gums, then it will cause inflammation because the gum will recognize it as a foreign body. And also when high, because when we are constructing the crowns, we have to consider the occlusion, the bite of the patient. So when it's high, then the patient will bite and it will, of course, cause some pain or headache. This is what I explained.
Okay. Thank you so much, Dr. Lucy. The other question that I wanted to ask you, but which Dr. Joy can also help with because of her specialization in maxillofacial surgery. Dr. Joy, you could maybe finish up what you were saying about the cancer and oral and dental health, and thereafter maybe tell us a bit about cleft lip and palate and what the dental surgeon's role is in it, and then Dr. Lucy can add on that. Dr. Joy. Dr. Joy, you're on mute. Please unmute yourself. Thank you.
Yeah. Well, I have finished with oral cancer and its complication and how we can manage it. As I say, we can do preventive measures, that is dental clearance, before taking the treatment for cancer. And after taking the treatment, still you need to make follow-up with your dentist to exclude or to remove any caries or anything that may arise later. Now, moving to cleft lip and palate, these are birth defect. These are birth defect, which are commonly found all around. When in development, cleft lip is for cleft lips. There is a cleft is an opening. The lips are supposed to be in one row, but with development, if it fails to be in one line, then it makes a gap, and that one we call it a cleft lip. That is in simple terms. Also, the palate, there are two parts, of which in development they should come together. But if they fail to come together, there where we get cleft palate. Now, there are causes for these ones. Some authors or some think it's genetically, it can be inherited from father, from your parent, but uh, but others think it is environmental. That's why for pregnant women, some things are avoided. For example, like drinking, smoking, and radiation, of which we have spoken. These things, all of this can contribute to cleft lip and palate. So prevention of the cause being, that's why I say when you're pregnant, you first go and then you consult before, even when you're thinking, you consult, you go for x-rays. If it is not an emergency, you don't do it. If it is an emergency, then go for it. You use don't use tobaccos, don't use a lot of you have to be careful. You don't walk and then you fall. Trauma, these are some of the causes which leads to all this cleft. Now, for treatment, it is a surgical treatment, but it is a I say it's a multidisciplinary. It's a teamwork, whereby there's an oral maxillofacial surgeon, there's a plastic surgeon. There is also not only oral maxillofacial surgeon as a specialty in dentistry, but there are those who are relining the teeth. These are the orthodontics. They are all there. So it is a multidisciplinary work. Now, for us, for the cleft lip and palate, for the oral maxillofacial, they go for surgery with those of plastic, and they fix it. And usually the lips are fixed first and then the palate later, because of the growing of the bones, not to limit the growth of the bones. Limiting the growth of the bones means narrowing the upper or the maxilla. So we always go for the lip and then we go for the palate. And then we see for orthodontics, they come for the lining of the tooth. Not only that one, it also affects speech. So we have to see for those who are concerned about speech, they also come. So it is a multidisciplinary, or it's a teamwork for cleft lip and palate. Thank you.
Thank you so much, Dr. Joy. I think you have given a very good overview of that. And unfortunately, since you don't have pictures to show, probably most people are finding it difficult to imagine what we're talking about, but you can always go and check. And yes, it is a multidisciplinary kind of management. And because it's in children, then it's important to allow for the bone to grow. So Dr. Lucy, the next question is for you. If you have anything to add on the cleft lip and palate, you can add a few things. But your next question is also, what are the indications for braces in children and adults? What is the correct age to start wearing braces, and how late can one get braces? And how should one take care of them when they have braces?
Thank you, Dr. Ann. I think my senior, Dr. Joy, have finished everything about the cleft lip and palate, except an addition about the causes. I want to add deficiency of vitamin D and folic acid, especially in the first trimester for the pregnant women, and also women who are taking anti-epileptic medication. So in some literatures, it's one of the causes of having babies with cleft lip and palate. So turning the question about the braces, so I will start by defining braces. Braces are devices used in orthodontic so that to align or straighten the teeth, so that improve the appearance and also the appearance, or we call it the general look of the patient.
Yeah.
We have some indications. So those who are having crowded teeth, they have many teeth in one jaw, or maybe protruded teeth, the teeth which are inclined outward, need to be straightened. But also those who have spaced in all the teeth, not diastema, but we are talking about gaps between the teeth. and those who have malocclusion. When we talk about malocclusion, we mean the bite. Sometimes the upper teeth are overlapping the lower teeth, or vice versa, the lower teeth are overlapping the upper teeth. So in these cases, we need to do some orthodontic work. About the age for doing these braces, the correct age for doing it, it's between 8 and 14 years, when the primary or milk teeth are lost and we are, or there is eruption of the permanent teeth. But according to the American Dental Association of Orthodontists, they say that there is no specific age for braces because they have been seeing patients above 20 years coming for braces. So there is no specific age. So when is it late for braces? So you can get braces at any age, but the preferable age is when you are still young, because it's easier and it's less painful, because it's easy to move the teeth. Because when we talk about braces or orthodontic work, we are moving the teeth. So in when you grow older, now your teeth are comfortable in their places, so it will take more time to move the teeth. So it's never too late to get braces, because when you need a perfect smile, it's a lifetime goal. So no matter what your age, you still can get braces. So how do we take care about our teeth when we have braces? You know, we do the same care of having a good oral hygiene. You brush twice a day, but for those who are having braces, they rinse first, because food particles may stick on these braces. So you need to rinse first and then you brush after each meal. And also they have a specific toothbrush, which we call it interdental toothbrush. This is for cleaning in between the teeth and for cleaning of the braces. Flossing, of course, once a day. And then they can use also mouthwashes to remove also food remnants. They should avoid snacks, especially the sticky candies, gums, chewing gums, so that when they use these snacks, it will bring their braces out, or it might break. So this is what I can say about braces.
Thank you so much, Dr. Lucy, for that. And thank you for saying that you're never too old to get braces, because some of us are targeting the perfect smile, and it's great to hear that we can still get that. So before we wind up, I will just ask Dr. Ajak one question. You can just give us a brief overview, and then Dr. Joy, the questions on your screen there, I want to ask you a few things about teething in infancy and what some of the dangerous practices that have concerning teething are, and what all of you can give us your view about the removal of teeth in certain communities in South Sudan. So Dr. Ajak, then Dr. Joy. Dr. Ajak, when it comes to imaging in dental health, what are some of the tests that are done? What are the indications for these tests, and what precautions are taken in imaging, and are these services available in South Sudan? I think Dr. Joy had talked a little bit about that. Could you just give us a brief overview of that, Dr. Ajak, before we go to Dr. Joy?
Thank you, Dr. Annie. So mostly in the imaging in dentals, we use some of the common ones, and there's other ones we use them like in a low percentage. So we start always with the periapical, the most common one. It's mainly for diagnosis as well. And between these two, only the periapical is available in South Sudan. Then we have the panoramic, the lateral cephalometric, the cone beam, and the computed tomographic scan. And all of those are mainly indicated for dental treatment, but not all. Mainly, all the dental treatment needs imaging. but not all the dental treatments. To go with that, we need to know when to take an X-ray or when to do imaging. We need to have a reason at first. Like this scan or this periapical, we need it for diagnosis or for finishing a treatment of such and such. That's a justification for us by law to take an image. To protect the patients from the imaging consequences, we have to do like dose limitation by wearing those shields for pregnant women and making the aluminum film in the filming room and using low beam or low photon X-rays to reduce the effects of the X-rays on the personnel and the quality of the image as well. Because if you have a good quality of imaging, you won't have to take the image like 3 or 4 times. You will only have to take it once and you will be like exposed to it once. This is the most important things in the imaging in the dental field. Thank you.
Thank you so much, Dr. Jack, for that explanation and for also telling us that there's a lot of thought that goes into how to protect the patient from any side effects related to imaging. Dr. Joy, this question is for you. So the audience have asked how dentists respond to mothers and their concerns about teething in infancy, and the audience is also asking if you've encountered any dangerous practices concerning teething in infancy in the community, and what's your advice? Dr. Joy, teething, mothers, and infants.
Okay, thank you very much. Teething in mothers and infants, it's a nice talk, but I will just go briefly on it. As this develop in infants, or I can say from 3 months after birth, it acts as a foreign body to kids. That's why infants, when they have their teeth, it comes with fever, it comes with diarrhea, it comes with a lot of illness because it acts as a foreign body. Now, when it is out, then at least a kid is relieved or an infant is relieved. So our practices, I will go back to our practices. I have, from my experience, there are a lot of traditional practices, I can say, or I think it's from our grandparents' practice. That is especially when there's the canines, when they are coming out, because they are very tall and they are very strong and they're bulky. So that one, they causes a lot of illness, fever, diarrhea, and even the child gets weak and weaker and not even eating. So our grandmothers previously, or at ages, they ran for this, how do you call it? This, the local experts, I can say, they ran and they just remove the tooth part of that tooth. It is very common, called in South Sudan, it's called sunun lukbari, whereby to those people, and I say it is a damage. They damage the tooth because they don't know the anatomy and they don't know the structure. They just make some hot instruments and they put and they damage the parts of the tooth that have complications. It is have an immediate complication or a late complication. The immediate complication is doing this, entering into that area of the tooth. You may hit an artery and a child comes with bleeding. Getting into that area with an instrument which is not which is not which is infected, will cause infection in that area. So kids come with severe infection. This is what I experienced in South Sudan. Not only in South Sudan, but all over. I can say in Sudan.
Thank you, Dr. Joy. Thank you for, sorry.
Go and do is an emergency. We stop the bleeding.
Dr. Joy, okay. I think Dr. Joy is hanging a bit there. We're experiencing some internet issues in Khartoum. So Dr. Lucy, maybe you can answer this one before now we go to the round of challenges, recommendations, and conclusions. One of the audience have asked that there are communities in South Sudan that practice removal of teeth.
Yes, I'm back.
Sorry, Dr. Joy, you're back?
Hello?
Yes, go ahead.
Yes, Doctor. This is very important, the issue I'm talking about. So the late complication is after removing of that bud, later in life, the child will not have that permanent teeth. So these are all the complications. My advice is therefore for those mothers and infants or the infants developing teeth, when they come with those illness, please come to your dentist, let them advise accordingly. Not only that, those ones are for the infants, but also we have our elderly, we have cultures whereby there's removal of teeth. This was long ago, but it is there. Now what is happening, all people are coming, they want to fix their teeth. Because teeth, they manipulate your talks, the words which you speak. And some letters are associated with this. So with time, people come, they fix their teeth back so that they can speak fluently. So my recommendation or my advice is to parents who have their kids, please, if you feel there is any swelling in the gingiva, if there is any redness, anything with the teeth, consult your dentist for better advice. Thank you.
Thank you,
Yes,
Dr.
that's
Joy.
all.
You have actually answered the question I was going to ask Dr. Lucy about removal of the teeth and it affecting your speech, and that the fact that people are now actually coming for replacement. And Dr. Ajak had mentioned a few things about implants, and a bit shocking that it takes 8 months for that implant to settle in. That is a very long time. So we need to take better care of our teeth, because the treatment now, when you lose it, is a bit it takes too long and it's actually quite expensive. So we are almost now closing up the session, and now I would like us to go to talk a bit about the challenges that each and every one of you has experienced while providing dental services. If there are any specific to South Sudan, please mention, and then give your recommendations and conclusions. So Dr. Joy, will start with you. Challenges in providing dental services, recommendation, and conclusions. And then we will go to Dr. Ajak, and then Dr. Lucy will finish. Dr. Joy.
Challenges. Challenges facing the dental health. I can say generally we need to teach. I think there is a bit of in knowledge, or there is no knowledge about oral health. That's why we have all those complications. That's why people come late. That's why this a great challenge to us, because most of the cases when people come to dentists, they come because there is pain. So these ones, when they come, when there's pain, mean it have gone to some other stages. So this is one of the main challenges. Pain causes decay, and there are sequelae which follows if it is not treated. They come with infection, osteomyelitis, and trauma to the bone, and fracture bones, and everything can result. But if we can fix that challenge of pain and giving enlightenment to people and doing such talks to our people, then we can minimize that challenging. Now again, there need to be a communication with oral health personnel and general medical personnel. There is a gap here. Again, more challenges on the practical to furnish the dental hospital with the new dental tools, not only the to
Okay, we're hoping Dr. Joy will come back on in a few. And as her internet loads up, we can go to Dr. Ajak. Dr. Ajak, if you can, or Dr. Joy is back. Dr. Joy, continue.
then for the recommendation is for the general public: brush your teeth twice daily with fluoride toothpaste, clean your teeth in between, that is flossing, eat a healthy food, limit the taking of
Dr. Joy? Okay. Thank you, Dr. Joy. Hoping you come on soon. We have some challenges in Khartoum, but I think it has actually been good to us because we've had quite a lot from Dr. Joy. So when she comes back on, she will finish her recommendations. Dr. Ajak, challenges, recommendations, conclusion.
Thank you, Dr. Annie. So most of the biggest of the challenges I've seen in South Sudan, it's the patient understanding. So the patients understand that dentistry is about only a filling or an extraction, and that's it. When you explain other procedures, they'll be like, but isn't it supposed to be like performed under like a medical practitioner, a physician? So you'll be like, no, that's like our specialty and stuff. So they'll be like, oh, we don't know that. So we need to educate the public about dentistry more, as Dr. Joel said. The other thing is the postgraduate knowledge and continuous studies. Like most of our dentists now, they come to South Sudan after graduating from the neighboring countries or abroad, and then for them to continue and pick up the postgraduate learning from there, it's really challenging. It's zero. There is none in South Sudan. We need to start one. The third thing, it's the general recognition of dental health and the importance of dentistry as a vital branch in the medical field in South Sudan. Because I think the Ministry of Health in South Sudan, or the whole South Sudan community, they don't look at it as an important thing, while they suffer every day and come to hospitals and they can't find the proper treatment because of the lack of the equipment or the dental materials, or even the preparation of the hospitals or the peripheral clinics in Juba or the South Sudan in general. So the Ministry of Health needs to really recognize dentistry as a vital branch in the modern medicine today. Something else as well, nowadays there is some other dentists who are like graduated maybe from the neighbor countries. They call themselves dentists, and when you looked into their certificates or something, they haven't been attending like dental school for like over 5 years, or they haven't done any postgraduate training. They're actually like a dental assistants or or dental nurses, they come into South Sudan and they start acting like they are dentists. They cause a lot of complications and a lot of misconceptions. Like they pull the dentistry in South Sudan backward, which is not favorable. So if you go into a dentist in South Sudan and you're a patient, you need to ask about the dentist first, the name of the dentist, where did they graduated. You need to see like evidence of this guy or this person being a dentist. You need to ask other dentists as well to confirm that this person is a qualified dentist to treat you or the other patients in South Sudan. That would be all for me. Thank you.
Wow, I like that angle, Dr. Jack, about the issue of people who have not completely qualified in dentistry coming into South Sudan and practicing as though they're dentists, and then resulting in a lot of complications to patients that they treat. And I think that falls towards our governing bodies, the ones that should be looking into the people practicing in our country. And this even rides over into the health profession. The fact that we should have rules, should have regulations, we should have regular checking of facilities to ensure that the people who are practicing there are actually trained and equipped to the skills and the knowledge to practice what they claim they are specialists in. And this is something that we really need to look into in our country. And it's definitely difficult because we are starting out, but if we can lay a base and a foundation in terms of regulating medical and dental practice, then I think we will be better off and we can protect our people from some of these complications that might occur due to practice by people who are not actually licensed to do some of the procedures that they end up doing in our country. So, Dr. Joy, if you can hear me, I'm afraid that you might go off. So can you please give your conclusion before we go to Dr. Lucy?
Okay. Okay, thank you, Dr. Anne and my colleagues for this session. Although with the interruption of the internet, things did not went smoothly, but it's okay. In my conclusion, I would like to conclude that at least for South Sudan, I will talk especially for South Sudan, we will like to promote oral health all over South Sudan. As we have done, there was a program which we did for Cleft Lip and Palate, and we were almost treating 100 above patients for Cleft Lip and Palate. That was a program, and it was successful. So we need all to come and raise oral health education and promotion in South Sudan, and that's by promoting good oral health and giving conferences and lectures. And above all, we urge and we see into it if College of Dentistry can be incorporated in one of the universities so that at least we have a huge number of personnel so that we promote oral health in South Sudan. Thank you.
Thank you so much, Dr. Joy, and thank you for joining us from Khartoum. I know it's really difficult. You're actually one of the first panelists we've had from Khartoum, and you are evidence that we can actually bring more people from Khartoum to speak on this forum. So thank you so much for that conclusion and for always talking about the promotion of oral health and education of the public on oral health, because I think that's a thing that is missing when it comes to dental and oral health. The fact that we all wait for things to go south for the time when we've gotten cavities and the teeth are paining for us to show up at the dentist. And that is something that needs to stop so that we can actually save our teeth. So I will go to Dr. Lucy. Dr. Lucy, please give us some of the challenges you've experienced, some of your recommendations, and give us your conclusion. Thank you.
Thank you, Dr. Anne. So I think most of the challenges have been mentioned by my senior colleague, Dr. Joy, but I will try to emphasize on some of them. The challenges in our practice, especially in South Sudan, we have lack of equipment, especially the advanced one, also lack of dental materials, or sometimes they are there, but you reach a time that they are finished. So when you wait until you get a new delivery, it will also take time. But also we are lacking trained dental assistants, because we know that a work of a dentist is not just simple, you examine the patient or something like that, but it's hand-on. So you are working on the patient. So you need a well-equipped dental assistant to be around you. So we also lack knowledge and awareness about dental services in South Sudan. So our people, we need to give them oral health education so that at least they will know something about the dental services. And how can we do that? Through researches. We lack researches in South Sudan. So we don't have any research in South Sudan concerning any of the oral diseases. So that's from this platform. I just want to tell my fellow female dentists that we have to do something about researches. We need to do some simple researches about the cases in South Sudan. And also late of presentation, as we have already mentioned, with dental or oral diseases. Sometimes our people, when they have a simple problem, they go for traditional or herbalist. After they have done and exhausted everything, then they come to you with a late presentation. So we want to encourage from this platform that whenever you have a simple case, just show up to your dentist. And not only that, but we have ignorance about dental visit. We don't visit our dentist regularly. So I want to encourage you to visit. And also we have the other big problem, the low socioeconomic status of our people, which sometimes limit the treatment. So somebody will come that need root canal treatment, but because they don't have the amount to pay for that treatment, they need it for extraction. So sometimes the low socioeconomic status, it limits the treatment we are giving. So my recommendation, I'll focus more on women because we are the backbone of our families. So we have to be an example showing the correct way of how we brush our teeth, because even our children, when we brush our teeth twice a day, they will follow that footsteps. So we have, because when we give them that courage of brushing twice a day, they will follow us and they will brush. So brush twice a day, don't forget to brush before you sleep, and floss your teeth at least once, and then don't forget to go for routine checks. And the other thing, drink a lot of water. And I want to add, don't give your children sweet, give them fruits, because it's more healthy than damaging their teeth. Conclusion, I want to thank those who nominated me. And for Dr. Anne, thank you for the opportunity to of what and share what some of our knowledge. And I want to say thank you to all the women who are behind there listening. And I want to encourage them that they have to do more about toothbrushing, because oral health, it maintains potential for our general health and the quality of our life. And also from this platform, I want to thank my husband, Dr. Gift, the maxillofacial surgeon. Thank you.
Thank you so much, Dr. Lucy. And thank you for thanking your husband. I can see he's also in the dental health section. That's great. Thank you so much, Dr. Lucy, for coming, and thank you for availing yourself for this discussion. And thank you for those simple suggestions that you've given us on how we can take care of our dental health, and the fact that we have to take care of our children, because, okay, maybe it's too late for some of us, but it's not too late for our children. So as we close the session, I want to thank you all for joining us and for giving us your time and your experience and your skills. This is the first time we're having dental health professionals from South Sudan featuring here. And I think now our people know that there are specific people that they can contact when they need dental assistance. Dr. Ajak is joining us from Nairobi at the moment. Dr. Lucy is joining us from Juba. So for those in Juba, if you need dental health services, you know where to go. Dr. Joy Rubena, who is currently off the screen, is joining us from Khartoum for the very first time on the forum. We have a panelist from Khartoum, and she's one of the senior most in this panel, and we are so grateful that she made time to join us today. So thank you so much. And in summary, I think the takeaway points are that we need to visit the dentist even before that tooth pains, because there are certain issues that we're unable to identify just by looking at our teeth physically, and that prevention is actually better than cure, and therefore these regular visits are very important. And also we have heard from our dentists that our services in South Sudan are in dire need of improvement, and this is something that we need to look into, even as people belonging to the community in South Sudan and in the diaspora, that we need to invest back home in terms of dental health services. And as I said before, this is something that's not covered by the universal healthcare package, and it can be very expensive, and it's up to us to ensure that our teeth don't get to a point where we need those expensive interventions. And when they do, then we have the services that are needed to make sure that we are able to take care of our dental and oral health. So thank you so much, Dr. Ajak. Thank you, Dr. Lucy. Thank you, Dr. Joy in absentia. And thank you for those who are behind the screen and helping us with streaming this session. And I would like to thank the audience for joining us for this important discussion. And we look forward to seeing you tomorrow on our session, on our special edition, where we will be talking to the South Sudan Minister of Defense, Honorable Angelina Teng, and our capable moderator will be moderating the session. And we look forward to seeing you there tomorrow at 5 p.m. East African time and 4 p.m. South Sudan local time. If you'd like to see more about the poster, then you can check out our Facebook page and see whether you can join us for that session. But I want to thank our panelists today very much for joining us. Thank you so much, and goodbye. Thank you.